We will see in this video about the femoral artery in detail and the anastomosis it participates with its neighboring arteries. So as I said, this is the diagram. This is the femoral artery. Okay, this is the profunda femoris artery. Okay, so this is the pectineus muscle. This is adductor longus, this is adductor brevis, and this is adductor magnus. So initially, the profunda femoris in the femoral triangle is between the pectineus and adductor longus, and then it is between the adductor longus and the adductor brevis posteriorly. And lower down it is between the adductor longus and adductor magnus, which is posterior. Here the profunda femoris is between, that is in the groove between the pectineus and adductor longus in the floor of the femoral triangle. So as it goes little deeper, it is having adductor longus anteriorly and adductor brevis. It is between these two, and little more lower down, that is lower to the femoral triangle, it is between the longus and the adductor magnus. This is what is the profunda femoris artery. So now this profunda femoris artery gives off the medial circumflex artery, the one which is going like this here, which is going posteriorly. This is the posterior aspect. So this is the medial circumflex femoral artery. This is the anterior aspect of the thigh region. So this is the lateral circumflex femoral artery. So it gives the medial circumflex femoral artery, the lateral circumflex femoral artery, and 1, 2, 3 and 4 perforating arteries. 1, 2, 3 are the branches of the profunda femoris artery, and this profunda femoris artery continues as 4th perforating artery. Okay, this is 1, 2, 3 and 4 perforating arteries. So here you can see this is 1, 2, 3 and 4. Perforating, that means they perforate, they pierce the adductor magnus muscle. There are few of these osteoeponeurotic openings within the adductor magnus at its insertion onto the linea aspera of the femur. It gives off these few small openings in the adductor magnus where these perforating arteries, they pierce the adductor magnus. Okay, so this is the medial circumflex femoral artery. It leaves the femoral triangle, passing posteriorly between the pectineus and the psoas major muscles, and then this medial circumflex femoral artery is between the anterior and posterior divisions of obturator nerve, whereas lateral circumflex femoral artery, as we have seen, is between the anterior and posterior divisions of femoral nerve. So now coming to the lateral circumflex femoral artery. The lateral circumflex femoral artery, it is between the anterior and posterior divisions of the femoral nerve. It passes deep to the sartorius and rectus femoris, dividing into ascending, transverse and descending branches. Similarly, the medial circumflex also divides into ascending, transverse and descending branches. And these perforating branches, they are 4 in number. They perforate the adductor magnus and contribute to the supply of the muscles of the medial and posterior aspects of the thigh, and also in formation of longitudinal anastomosis. Right. Now coming to each branch, let us see a bit of it. The lateral circumflex femoral artery. This arises from the lateral aspect of the profunda femoris artery, and this is the largest branch. And this lateral circumflex femoral artery, this one, is seen between the divisions of the femoral nerve, that is between the anterior and posterior divisions of the femoral nerve, and then it passes laterally beneath the sartorius and divides into ascending branch, the transverse branch, and the descending branch, and then it winds around the neck of the femur. So the ascending branch, this one, this is the ascending branch. This is the lateral circumflex. This is the ascending branch. Yeah, this is the lateral circumflex. You can see we have cut the rectus femoris and the sartorius. This is the sartorius, this is the rectus femoris, to clearly visualize the branches of the profunda femoris. So this is the profunda femoris, the lateral circumflex. So as it passes beneath the sartorius here, it is dividing into ascending, transverse, and descending branches. So let us see the ascending branch now. So the ascending branch, this one, it passes upwards beneath the tensor fascia lata muscle. This one, this is the tensor fascia lata. This is the anterior superior iliac spine. We want this branch to go till here because it is participating in the spinous anastomosis. For it to go till here, it has to pass beneath the sartorius, beneath the rectus femoris, and beneath the fascia lata muscle, right, to the lateral aspect of the hip and anastomosis with the terminal branches of the superior gluteal artery, the deep circumflex iliac artery, the superficial circumflex iliac artery, to form the spinous anastomosis. And it also contributes for the trochanteric anastomosis within the trochanteric fossa as well. So all these anastomosis, when we say anastomosis, it is a collateral circulation that is established and will become more prominent, circulating blood when there is blockage of the major arteries. Coming to the descending branch, this is the descending branch of the lateral circumflex femoral. This is the descending branch. You can see here, right? This is the descending branch. Okay. Now this descending branch, it runs downwards, okay, behind the rectus femoris, resting on vastus intermedius and along the vastus lateralis. This is the rectus femoris which is cut. Okay. So this is the descending branch of the lateral circumflex femoral artery. This one we are talking about. Okay. This one we are talking about. So as it descends down, it is behind the rectus femoris, resting on vastus intermedius and along the vastus lateralis. Okay. And then supplying all these muscles. As it descends down, it is accompanied by the nerve to vastus lateralis as well. As it descends down, you can see here, and it anastomoses with the superior lateral genicular artery, this one, participating in anastomosis around knee joint. Is that clear? It has a very important clinical feature. When we look into the cruciate anastomosis, we will see what the clinical feature is. So as of now, the descending branch, as it descends down, it is behind the rectus femoris muscle, resting over the vastus intermedius and along the vastus lateralis. Along with the nerve to vastus lateralis, it descends down, and then it participates anastomosing with the superior lateral genicular artery, contributing for genicular anastomosis, which is nothing but anastomosis around the knee joint. Now coming to the transverse branch. This is the transverse branch. Okay, yes. So this transverse branch is the smallest branch of the lateral circumflex femoral artery. It winds round the neck of the femur anteriorly. This one you can see, this one. Okay, so it passes laterally over the vastus lateralis and then winding round. It pierces the vastus intermedius actually, and then winds round the neck of the femur just below the greater trochanter. This is the greater trochanter, this is the lesser trochanter. Anastomosing on the back of the thigh with the medial circumflex femoral artery, participating in cruciate anastomosis near the lesser trochanter behind. Okay, so the transverse branch, anastomosis with the transverse branch of the medial circumflex along with the branch from the inferior gluteal above and the first perforator below, and forms the cruciate anastomosis nearer to the lesser trochanter behind in the back of the thigh. That is called as cruciate anastomosis. So this transverse branch of the lateral circumflex femoral artery participates in cruciate anastomosis. This is the cadaveric dissection. You can see this is the femoral vein, this is the femoral artery, this is the profunda femoris artery, this is the femoral nerve with its divisions. So this is the posterior division, this is the anterior division. Okay, you can see the lateral circumflex artery between the anterior and posterior divisions of the femoral nerve. This is the ascending, this is the transverse, and this is the descending branches of the lateral circumflex femoral artery. Okay, here you can very clearly see this is the ascending branch going beneath the sartorius, which is cut here. This is the rectus femoris, which is cut, so it goes deep to the sartorius, rectus femoris, and then deep to the fascia lata muscle, and then goes till the anterior spine to participate in the anastomosis. The transverse branch, it is also deep to sartorius, the rectus femoris, pierces the intermedius, and then winds round the neck of the femur to join with the transverse branch of the medial circumflex femoral artery participating in the anastomosis. So this is the descending branch, which is accompanied by the nerve to vastus lateralis, again behind the sartorius, behind the rectus femoris, resting on the vastus intermedius along the vastus lateralis, descends down to participate in the anastomosis around the knee joint. Okay, now coming to the medial circumflex femoral artery. This is the femoral artery, this is the profunda, this is the medial circumflex femoral artery, okay, which goes between the anterior and posterior divisions of obturator nerve. So this artery, it supplies the neck of the femur. Most of the blood supply to the neck of the femur is by the branches of the medial circumflex femoral artery. So any blockage or damage to the medial circumflex femoral artery, that is the fracture of neck of the femur, can lead to avascular necrosis of the neck of the femur, where it has to be replaced for proper functioning of the movements, the hip movements. So that forms a very important clinical feature with the medial circumflex femoral artery. So this medial circumflex femoral artery, it arises medial to the profunda femoris artery in the posterior aspect, and then it winds round the medial side of the femur and posterior to the neck of the femur. So as it passes first between the iliopsoas bow and the pectineus. That's how it passes. And then between the obturator externus and the adductor brevis. As it crosses the adductor brevis, it divides into superior, transverse and inferior branches. At the upper border of the adductor brevis. So the ascending branch, it participates in trochanteric anastomosis. The transverse branch, it participates in the cruciate anastomosis, and the descending branch, it participates in the longitudinal anastomosis. So you can see the descending branch, it descends beneath the adductor brevis, okay, to supply the adductor magnus. Anastomosing with the perforating arteries of the profunda femoris artery. And the transverse branch, it participates in the cruciate anastomosis. So let us see then. Both the lateral circumflex femoral artery and the medial circumflex femoral artery, as we said, they join each other, forming an extracapsular arterial circle. From this extracapsular arterial circle, both the lateral circumflex femoral artery and the medial circumflex femoral artery, they give radiating arteries which pass into the capsule of the hip joint to supply the head and neck of the femur, anastomosing with the acetabular branch of the obturator artery, which passes through the ligament of head of the femur. So from the ligament of head of the femur, here you can see the acetabular branch of the obturator artery, it enters inside the hip joint and anastomoses with the retinacular branches or the radicular branches of both the lateral circumflex femoral artery and the medial circumflex femoral artery, which happens to be the main blood supply to the neck of the femur. So when there is any fracture of the neck of the femur, okay, there will be avascular necrosis of the head of the femur, which in case the head of the femur has to be replaced by prosthesis for the smooth functioning of the movements. Here you can see the retinacular arteries of both lateral and medial circumflex, how they are supplying the neck and head of the femur, and anastomosing with the acetabular branch, which enters via the ligament of head of the femur, okay, to anastomose with these circumflex branches and at the neck of the femur. let us see the branches in the adductor canal. The important one to be told about here is the descending genicular artery and few of the muscular branches. So this is the descending genicular artery, this one, which is going medial to the femur, medial to the knee joint, and medial side of the tibia. So this arises from the femoral artery just before the femoral artery passing through the adductor hiatus, which is the fifth osteoeponeurotic opening, from where the femoral artery, it courses onto the back of the thigh and into the popliteal fossa, continuing as popliteal artery. So just before the femoral artery entering into this adductor hiatus, it gives this branch, which is the descending genicular artery. And this immediately it divides into a saphenous branch and a musculoarticular branch, this one. So this saphenous branch, this pierces the eponeurotic opening of the adductor canal and accompanies the saphenous nerve to the medial side of the knee. It then passes between the sartorius and gracilis. And then this also pierces the fascia lata and is distributing to the integument here around the knee joint and the medial aspect of the upper part of the leg. As the saphenous branch descends down, you can see in this picture, this is the saphenous branch, it's coming down, and it is anastomosing with the medial inferior genicular artery, which contributes for the formation of the anastomosis around knee joint, which is called as genicular anastomosis. So the saphenous branch, it anastomoses with the inferior medial genicular artery. And now the musculoarticular branch. The musculoarticular branch, it descends down in the substance of vastus medialis and in front of the tendon of adductor magnus to the medial side of the knee. Here, this side, this is the articular branch, musculoarticular branch. So here this, at the knee, it anastomoses with the superior medial genicular artery, contributing for the formation of the genicular anastomosis. And this musculoarticular branch also gives a branch which passes above the patella, crossing the patellar tendon, joining, anastomosing with a branch from lateral superior genicular artery. All these supply the branches to the knee joint. So here, to be in short, the descending genicular artery, as it courses medially, divides into two branches, saphenous branch and musculoarticular branch. The saphenous branch descends down, articulating with the medial inferior genicular artery. The musculoarticular branch anastomoses with superior medial genicular artery and also with lateral superior genicular artery, contributing for the formation of the genicular anastomosis or the anastomosis around the knee joint, and the muscular branches to the surrounding muscles.